My name is Chris Lowe, and I'm a paramedic in Lexington, South Carolina. This is my presentation on careers in EMS. We're going to cover some information today, which I hope answers some questions for you. So we're going to go through different job descriptions, and we're also going to touch base on different types of jobs in EMS, the education and work experience you should have coming into this field, as well as the earning potential, potential for growth in the future, and some intangibles that I think are what really make this an awesome job. So, the emergency medical technicians care for sick and injured, oftentimes through the 911 service. However, there are several opportunities to work in the field that are non-emergent type jobs, be it there's in-facility transport where someone may be being treated at one hospital and they need to go to a specialty center. There's air transport. Most recently, for example, people were in the Caribbean and the hospitals were out, so some of the more critical patients were flown stateside. There's tactical medicine. There's um, offshore needs. So there's EMS employees on oil rigs. There's contract work available. There's a lot of work available that is outside of the normal 911 activity. So a brief history of EMS. The first modern EMS service was established in 1967 in Pittsburgh. It's called Freedom House. And prior to Freedom House, the emergency responses were handled either by the police department or the funeral home. And particularly a part of Pittsburgh, neither one of those agencies were willing to respond. So some citizens formed the first modern ambulance service. Today, a little over 50 years later, it's a extremely high tech position, and there's real time interactions with doctors on the trucks. The vehicles are so much safer. The protocols are based off of evidence based medicine instead of figuring things out on the fly. So modern EMS is really exciting and it's growing really fast, and more information is coming out faster than it can be published. So the different positions in the field, there's EMT basic, which is kind of the entry level position. Um, they can't administer any narcotics. They do provide patient care, basic life support, and it's a potential to learn and grow. So from there, you can become an advanced EMT, uh, which has slightly more invasive procedures. You can begin IVs and give some medications again, but no narcotics and no cardiac drugs. And then the next step would be a paramedic. Um, they have the potential to administer narcotics for pain, administer cardiac drugs. You can perform some invasive procedures such as intubation. Um, you can administer medication different routes through the IV, orally, intranasally, and there's intraosseous, which is where you have to drill into a bone and administer medicine that way. So, touching base briefly on education and experience, the EMT basic requires a high school diploma and about 120 hours worth of classroom work and a little bit of clinical work. From there, you can choose to become an advanced EMT, which will require um, more classroom education as well as clinical time in the hospitals to work on different skills that you didn't have as a basic. And then paramedic certification, it's as more and more technology and information becomes available, the paramedic scope of practice continues to grow. So much so that a lot of places are offering as a 2-year degree, such as Ori Tech. We're going to talk about earning potential. Um, so the highest paid medics in the nation are in Las Vegas, or not Las Vegas, but in Nevada, and they're making about $40 an hour. And the lowest paying ones are in Oklahoma, making around $15 an hour. Compensation is difficult to easily label. There's so many different models for um, payroll management in EMS because it has to be staffed around the clock. So some places offer 24-hour shifts. And if you work 2 24-hour shifts in a week, you're making time and a half before you know it. So And those numbers are not reported into a lot of places' base salary. And then it's an ever growing and competitive field. Most agencies or larger agencies are offering sign-on bonuses, even so much as providing free health care for their employees. Almost all of them have a pension plan, at least, or a 401k that's competitive. And it really is a competitive field where people are trying to recruit employees. Growth potential, briefly, as the population continues to get older, more and more services are needed outside of the hospital. And the other part of that is that more and more hospitals are becoming specialized and, again, requiring transport to their facility. They may be a stroke center, one stroke center in a town, and they need 4 other hospitals need to transport people to the stroke center. So those type of interfacility transports are a huge opportunity moving forward. And EMS is really outgrowing the rest of the workforce. We're growing at about 15% a year over occupations. Other occupations are growing about 7%. Favorite thing, the intangibles. What makes this such a fun job? So it's an ever-changing work environment. So you don't go to work 2 days in a row and have the same experience. You've got no control over your day. You go to where the calls send you, and it's a lot of fun. Some days are busy, some days are not. I get to do homework some days, and some days you're eating a Pop-Tart for lunch. So it's a fun, ever-changing job. You have a huge opportunity to interact with so many different people. You may be in a very poor part of town, with someone who cannot sign their name on your computer when you get them to the hospital because they can't read or write. Or you may be in a multi-million-dollar home 10 minutes later dealing with someone who's got a sick baby. So it's really a cross section of society you get to interact with. You have to make decisions fast. Oftentimes you're on the side of the road with 10 different patients and trying to figure out the best way to take care of all those patients. And it requires you to think on your feet. You make mistakes, you learn from them, and become a better provider because of that. And then really being able to help someone on their bad day. If you have a cardiac arrest and you somehow things align and you successfully resuscitate them, that's a day you'll remember for the rest of your life. And their family, interacting with the patient after they come out of the hospital, it's a really special experience. So you can't take that away. It's an amazing part of this job. So this is my information. If anyone has any questions about how to get into EMS, or if it's something that would interest you, please feel free to either email me or call me personally. And I thank you very much for your time.